Hello, everyone. Going to make sure this is going to work. Everybody can hear me okay? Yep. Excellent. So welcome. This is the session for Medical Radiation Sciences. It's an honors undergraduate degree, and I'm Laura Thomas. I'll be giving the presentation today. So just so that you understand who I am and how this works, I actually am the Associate Dean of Medical Imaging for Mohawk College. And the way this program works is it's a collaborative program between Mohawk College and McMaster University. So we both work together. I've done these presentations for the last 6 years, and it seems always very confusing for people because there's so many different varieties of how colleges and universities work together nowadays. But the interesting thing about this one is we were one of the first. It was 2004 when this program launched as a collaboration between the university and the college. And we'll talk a little bit about the structure of that as we make our way through the presentation. But we have worked collaboratively. A lot of the people here I know well. I've worked with them. I mean, we all work together to deliver this program. Located here on campus as well. Which is something that a lot of people get a bit confused about. The Institute for Applied Health Sciences is a Mohawk-McMaster shared building. And so most of the program for MedRad Sci is, in year one, it's sort of all over the university, but in year two, it is predominantly in that building here on campus. Good pizza, just an FYI. They're close to Starbucks, so not a bad thing. All right, let's get started. So welcome, everyone. This is our land acknowledgement. McMaster University and Mohawk College actually as well. We both recognize that and acknowledge that this, the institution, McMaster University, is located on the traditional territories of the Mississauga and the Haudenosaunee nations. And they're within the lands protected by the Dish with One Spoon Wampum Agreement. I always want to pause here because I think about this space. And if anybody actually knows McMaster University and has seen the grounds, it's beautiful. And we side right on to the where the harbor used to be for the protected bay from Lake Ontario. And it's an interesting thing when you think about what this land must have been like, hundreds of years ago when nobody had buildings on it. It would have been an area where I'm sure the indigenous peoples of this area really thrived. So it's just a pausing moment to reflect on, yes, this is a bit of a checkbox for a lot of people to just say this, but it really means something here. This is where people would have lived. So it's an interesting thing as we make our way through to reflect on it. As a healthcare provider as well, the calls to action are part of our curriculum. It's a very important piece for learners to understand, for instance, what does a Dish with One Spoon Wampum Agreement mean? And what does unceded territories mean? So it's something to consider if you're looking at this healthcare path, and it's part of what your learning will look like. So this is me. Again, I am an employee of Mohawk College, and I'm also the academic director for the Center for Integrated and Advanced Medical Imaging, otherwise known as CAMI. It's just far too long to write, the Center for Integrated and Advanced Medical Imaging. Over in the IHS, the building that's here on campus and shared between Mohawk College and McMaster University, there's an MRI. It's a 3T Cigna MRI. We're actually doing clinical care with Hamilton Health Sciences and St. Joseph's on that MRI, as well as research and as well as teaching. So that is the center itself, and through that we offer different pathways to research that will be sort of specific to MRI, but also all of the imaging professions. Other programs that run in that building are cardiovascular technology, pharmacy technology, all of our nursing programs, both the BSCN and the PN. So there's a lot of healthcare. It's like walking into a small hospital. Okay, so this is just an overview of what I'll cover today. Basically just talk about each of the levels and what does it look like to be a student in medical radiation sciences. Talk a little bit about the clinical experience and all of the opportunities that are out there. And so for anybody who watches the news, you recognize that there are a lot of opportunities out there in healthcare. We are looking for people to provide care in the future. And that's why I'm still in my job, not quite retired yet, because my job is to make sure you guys all graduate and get out there and provide excellent care. Because when I when I retire, I want to make sure that there's a good infrastructure for healthcare. So, all right. So first year. So this is a direct entry program, medical radiation sciences. It's classified as one of those programs where we are really catering the design of the program for somebody who's coming in from high school. We want to sort of build a knowledge foundation in year one, and the goal of it is to ensure that students can pathway into year 2, 3, and 4 at an informed level, but also with a base foundation of knowledge. Our target enrollment, 115. They say 115. Last year we had 147. The year before that we had 112. We strive, or we hope for, anywhere between about 120 and 126. It works out well when we distribute the 3 different streams in year 2. Right now they're saying the admission average is typically around the low 90s, and that's based on last year's applications. You'll understand that each year that might change a little bit, but the goal is to aim high, obviously. So this is, I'm just trying to see what we're covering here. Yeah. So this program itself is, the actual imaging profession in Ontario is regulated. So there's a governing body called, or regulatory body called CMRITO, and they oversee everybody who graduates in the province. What is really good about that is that although you have to pay dues, and they are not cheap, you pay those annually, they ensure that there's not people coming into these professions that don't have the actual ability to do the job. What happens often is like, oh, you know, ultrasound's not that bad. It's not harmful to people. We'll just teach this person how to do an ultrasound, and then they'll be able to do the scans. Can anybody tell me how, and preferably a student, potential student, can anybody tell me how that could be harmful to a patient? Ultrasound is not harmful energy. Sound waves are fine. How could that be harmful to a person? Yeah? Yeah, misdiagnosis. Somebody's going to walk away thinking that everything's fine, and it's not. And that happens a lot, and that was happening a lot with sonography. So radiography and radiation therapy have typically been regulated because, can anybody tell me why the radiography and radiation therapy would be regulated? Yeah? Pardon? Yeah, the radiation is harmful. That energy is harmful. So using radiation for imaging or for treatment is harmful. And so you have to have that knowledge. So the government has been very solid about ensuring that that's regulated. But now the other sonography and cardiac sonography are also regulated in Ontario to make sure there's an extremely high standard. The CMRITO they ensure annually that people are continuing to learn, that people are abiding by all of the guidelines, that they understand where rules are coming and changing as things go by, or as things change in society. So it's actually been a bit of a bonus for all of the professions. Other provinces don't necessarily have the same regulation. Not all provinces are under the same type of regulatory body. Some are regulated. But the way we teach at Mohawk and McMaster is the national competency profiles, which are national competency profiles, which means that you can go anywhere. You can take when you graduate and you write the national board exam, you can work either in Newfoundland, or you can work on Vancouver Island. You can go anywhere in the country with this profession. If you're thinking about radiation therapy, I've talked to a few of you today, recognize that radiation therapy happens in cities. It's not something that's in a small community, so it's something to consider when you make that choice. All right, so this is what the first year looks like. A little bit daunting, I think, but it's actually fairly doable. We just introduced students to the anatomy. So actually, Krista Howarth, who I was chatting with when you guys first walked in, she actually is our anatomy professor. And so the reason why is our students take 1Y03 with kin. So the kinesiology students and the medical imaging students all learn anatomy together. So it makes it a really sort of robust educational opportunity for the students. The the course 1B03 and 1F03 are taught by Mohawk College. The reason we teach those, obviously 1F03 is Professions in Medical Radiation Sciences. For those of you who, start in this program next fall, please pay attention in that course. And the reason I say that is because that's where you're going to learn about the 3 different professions. And a lot of the students come in and they're so focused on all of their other things that program, the course itself is more informative and engaging with the community. And so they kind of put it on the back burner. And then they get around to March when they have to actually choose which profession they want to go into. And without that foundational knowledge, they're sort of lost trying to figure that out. So the students choose in the spring of year 1 which profession they want to go into. With the knowledge from intro to the professions in medical radiation sciences, you will be able to go for tours in our departments. You'll be able to talk to people who work in the professions. We have a night with the experts where all of the people who are working in different levels of the profession are there to speak and answer questions about what does it look like to do this job. Where can I go with this career? That type of a thing. The intro to physics for medical radiation sciences gives you an overview of all of the physics. So it kind of gives you a little bit of a taste of what the physics would be like in the second year, where you'll dive more deeply into the profession-specific physics education. And of course, the ever popular math. Intro to Pathology, we deliver that course as well, because what we do in that course is start to give you some understanding of imaging as associated with the pathologies. So you'll start to see some x-rays and some CT scans and some of the imaging, so you'll understand how your role is integrated with that patient's journey. You get to choose like I said, at the end of semester 2, what profession you'd like to go into. I hate the word ultrasonography, but unfortunately it's on some of our documents and it is archaic. It doesn't exist, I'm not going to lie, for anybody who's trying to go out there and talk about ultrasonography. It's the combination of 2 words, sonography and ultrasound. And either are fine. You can say ultrasound tech. But ultrasonography is just an old way of saying it. Radiography, which is an X-ray tech, and radiation therapy. So 2 are diagnostic jobs. Diagnostic in the sense that we help diagnose what's going on. We look at the images. We work with radiologists to make sure that the best images are put together, or obstetricians when it's ultrasound. And that's how the reports get generated and the patients move through their healthcare journey. Radiation therapy is a therapeutic delivery of radiation. So those people have already had a diagnosis, and it's not always cancer. There are different opportunities or different situations where radiation therapy is used to support other clinical findings. But it is predominantly cancer, and a lot of people will say things like, I don't want to work with cancer patients, but I worked at the Juravinsky for a long time in ultrasound, and I'm not going to lie, it was probably the best experience I had. Working with cancer patients, they just have a much better, much more positive, much more thankful, much more engaging sort of interface with the community healthcare providers. So it's not a bad thing, trust me. So radiation therapy is, like I said before, it is predominantly in large cities or medium-sized cities, but it's not rural. It's in a small hospital, you always have X-ray and you always have ultrasound. It doesn't matter where it is. Like we're actually training an X-ray tech in one of our programs right now. We're training an X-ray tech from Wawa, and they have the whole department, right? Because they have to serve their community. Radiation therapy, we take about 25 to 30 students in second year and move in that direction. So what they're doing is they're using large amounts of radiation to kill or the actual tumors themselves, or slowly destroy the tumors themselves. And radiation therapy means that radiation therapists plan the therapy. So they have to figure out, where is the tumor in the body? How will we deliver the right amount of dose to the tumor without damaging other tissues? So it's a really neat profession, and if you have a real interest in physics, I would say this is probably our strongest physics course, with lots of calculations happening for the learners. They work exclusively in cancer centers, obviously, and they don't necessarily work with radiologists. They are working with physicists because they're calculating out dose. They're working with oncologists, the cancer doctors, to ensure that the proper treatment plan is in place. And that's how their role is. So it's a bit different. I would say that they do probably the majority of the research that we have peppered into medical radiation sciences, just because there's a lot of research that already happens in these departments. They're designed for research at that infrastructure. So they would, so a person who has radiation therapy, I'm certain that many people in the room have had a family member who've had radiation therapy. It typically goes for 10 days. And the person comes every single day, or I say typically, but a treatment plan is in place. Could be 10 days, could be 6 weeks. But the person comes every day for radiation. And so by day 3, you know the people. You know probably the person who's coming with the person. And it becomes a little bit of a family environment during treatment. So it's a nice environment, and the team that we have, the team members that we have that work in radiation therapy or have worked in radiation therapy, really love it. So just some images. So there's many different ways that radiation therapy is being used. They use CT scanners now. They're using MRI scanners to plan the treatment, to set up the treatment. There's something called brachytherapy, where they're using radioactive seeds and they're injecting it into the body. That's done with the physicist, but we plan that out with the physicist, and then that therapy can treat from the inside out. For radiography, we take about 60 to 65 students into each of the programs, or into each year, the fall semester of year 2. And X-ray techs work pretty much everywhere. Like I love that we always have hospitals and clinics at the top, but you can actually work for portable X-ray and go to jails and long-term care facilities. You can work for some portable X-rays or do locums up north and go to reservations. You can work in Nunavut. There's lots of opportunities across the country when it comes to radiography. The interesting thing about radiography, one of the reasons why we take so many people into this profession is because it is what we would call more of a pathway profession. People who go into radiography probably start their first few years in working in general X-ray. Those are your patients coming over from Emerge, or patients coming into a clinic and getting their X-rays done. But then they tend to move on into different areas of the department, whether or not they'll work in sort of gastric areas, CT areas, angiography, so where cardiovascular studies are being done, looking at the blood flow to the brain, any level of CT and CT integrated care as well. So radiographers have a lot of opportunity for changing and moving their profession as they're making their way through. The other piece is they're always looked at for, when you think about the GE and the Siemens and the big players, Canon, who are making this equipment, they need people to work in sales and in what's called applications, where they're showing people how to use the equipment. They need people to work in the development side. So there's just a lot of pathways when it comes to radiography. When it comes to sales and that integration, all of the professions have those pathways and opportunities. But radiography, in terms of just the sheer volume of techs across the country, there's more of them that are in that space. So it's a great profession. I started in radiography. I did my first training in radiography and worked as an X-ray tech for a number of years, but apparently I'm not built for nights, so I decided that that wasn't going to work for me. So that's the thing, is if you're working in a hospital for radiography, you will do shifts, and nights is one of those shifts. And apparently I actually shut off at about 2 a.m. no matter how much sleep I get, and started to get a little bit concerning for me as I was trying to do my job, that I thought this is a bit of a risk. So I went back to school and I did ultrasound, and I ended up working in that field, but then we started doing call and ultrasound, and I was there at 2 a.m. anyways. But at least I got a couple of hours of sleep outside of that. So both were great professions. So yeah, we typically work with radiologists when you're working in radiography. It depends on where you are, but radiologists are the ones who are going to be reporting those images. So just some X-ray pictures, the standard ones that you can find online, the little parts or whatever with hands. And then this one on the other side here is just a demonstration of some flow. When they put contrast into the body, that contrast gets taken up by the arteries, and you can see the arterial flow to structures. You can see narrowing in vessels. You can see a dilation in vessels, which is what it looks like we're looking at here. And you can sometimes, also demonstrate the venous flow. So, ultrasound takes about 35 to 40 students. It depends on our placements. We struggle quite a bit when it comes to placements with ultrasound. The reason that this happens is an ultrasound in X-ray, 4 or 5 students might be able to go to a department, because an X-ray department does all kinds of different things. They're doing portables. They're running the emergency clinic or fracture clinic. They're running CT. They're in the OR. They're all over the place. An ultrasound department is more of a one-on-one relationship with the student, and so it slows the department down when we have a student. Where the students in X-ray are kind of learning along the way. Radiation therapy, same thing, learning along the way. Ultrasound, once you put your hand physically on that transducer and start trying to scan a patient, you're slowing things down. And so it's just a piece that the departments don't want to take on a lot of students because they are so busy. So we struggle to get these clinical placements, and that's one of our biggest obstacles within the program. If you look at any of the programs that have this conversation with Michener, with Cambrian, with any of the programs that are delivering ultrasound, we're all dealing with the same thing. We all talk, we all know it's the same problem. Not to mention the fact that with ultrasound, you will also learn general things. So that's everything like abdomen, and looking at a gallbladder, and looking at bowel, and looking at just the pelvis, all those structures. And you'll also learn obstetrics. And in many hospitals that are larger centers, they're separated. You no longer go to the general department to have your obstetrical ultrasound. You go to a different site. And so that's where we're starting to struggle to make sure that students can get both of those locations in their education. At this point in time, we've never, had to delay anybody's progression. The hope is we will not. We have great relationships across the province. But the problem does become that the student may have to travel further out to get that actual experience. So maybe they're in Barrie, or maybe they're in Huntsville, so that they're getting that education. And that's part of what needs to be chatted or talked about as we make our way through. But it's a great profession, I'm not going to lie. It's a lot of fun. You get to work directly with the patient. You're working directly with the radiologist or the obstetrician. It's very image focused, and understanding the physics of how to get the image that sort of build on that. Here you can, I just love that this is one of the techs from Hamilton Health Sciences, and I believe this image might have been taken in about 2005. So I might update that one this year. So if you have the opportunity to see our labs, you can see we have very up-to-date equipment. So like I had talked about earlier, students rank their specializations first, second, and third choices, and most students get their first choice. Where a student may not get their first choice is if they are struggling academically. That brings them down to the lower pool, and then it's like they're the ones who are, they might end up with their second choice. I have never seen a student get their third choice. I have seen, on occasion, students get their second choice, but often it works out just fine for them. They're happy with both opportunities. I wanted to I'll see whether, nope, that didn't go. I wanted to show how this works for a student and for moms and dads who are here in the room, because students will start in the fall of year one. They go to school in the winter of year one. It all looks normal. You come home, you get your summer job, and you work. So you're finished at the end of April, and then you don't go back to the beginning of September. When you go into level 2, you actually are now in school solid for 2 solid years. So students come in and they do an academic level in the fall and in the winter, and then in the summer they go to clinical. It's only until about the middle of July. It's usually an 11-week clinical placement. So students still have 6 weeks or so before the summer is done, but it is a summer semester, and they do get credits during that. And then in level 3, we have same thing, though we come back in the fall, you go to school for 3 solid semesters. And in the summer, you again finish about mid-July, and then in the fall, you start your final clinical. And these 2 placements, if you're in sonography, you are going to go to one clinical at one location, to another clinical at another location. If you're in radiography or radiation therapy, typically you're just at one site for that final year. So just for that awareness. Okay, so the clinical experience, it's 11 weeks in the summer semester of CP1. We call them CP1, CP2, and CP3. And then we have the level 4, the CP2 and 3 are 14 weeks or 15 weeks. But we can add in time if the student is not progressing well. They're not co-op. You do not get paid. You are paying for these semesters. And like I said before, you may have to relocate for them. So it is an important piece to consider as you're coming into the program. It's 37.5 hours of attendance. You're working full time. Sometimes people are going to say, oh, it's a quiet afternoon. You can go home at 3 or whatever. But the truth is we're really trying to build that professionalism so that when a student graduates, they know that they can hit the ground running. And the students, we try, do not schedule vacations, not schedule trips for that time, because it's not like you can ask for the time off. If you miss time, you have to make that time up. So it's because it's school. And we're also paying for those placements to ensure that the students are learning. So, of course, we have our labs over in the IHS, which are really, especially if you're interested in the profession, it gives you really an idea of what it looks like a day in the life of a student. But we also have a big simulation lab there. We have a lot of rooms that are designed with simulation resources for sonography, for radiography, as well as for patient care. Because it is a sort of integrated design with nursing in that space, there's lots of resources in that building. All of our labs, the way we work it is we're trying to always keep our equipment up to date through different funding mechanisms with the government, as well as we make sure that a small amount of the tuition is really focused on that so that we can continue to grow and develop our labs themselves. We do have a new portable unit in X-ray, which is kind of fun for the students to see, because that's something that will happen in a clinical environment as well. Trying to see what else. There's a lot of simulated learning, obviously. There are some things that we can't do. We can't scan pregnant patients as a student here on campus, so we have a lot of simulated resources for that. For general ultrasound, we have some virtual resources for radiography coming to the table, as well as we have a fully functional CT scanner, which is pretty amazing to see over there as well. So, and so this is just a list of all of the departments and schools, and many times you'll be taking courses in different departments. That's something to think about, right? It's an awareness piece. If you're coming to the program and you're taking other courses, those courses, the teachers in those courses may not understand the scope of your program just based on the fact that they're in a different school, a different area. But lots of different pathways here. For the most part, these are all the ones we're connecting with directly. They have an understanding of our programs. Some of the electives students choose might take them in different directions. We've talked about quite a bit of this through the talk today, different opportunities for people where they're going to work as they make their way through. And then just the office of the these are just resources of different pieces that support students in their path throughout the education. Science and career, so there's lots of development at the McMaster University, building virtual education and virtual resources that they're trying to integrate in almost every aspect of your learning pathway. And then just research, we have a lot of students in the MedRad Sci program who do participate in research. We have an official research course that runs in the third year, and students can do a 6-credit research course over that 12 weeks in the summer semester, typically working with a community partner or somebody here at the university. And then it's just, just looking at the academic plan and finding all of the resources on the website